This worked out very well because we have one question for each of the panelists. So why don't we just go right down the row. We'll start with Charlie. Question is, how might healthcare reform affect Iowa Medicaid eligibility standards for long-term care? I think the issue here is assets, status of depletion of assets or transfer of assets. Is there anything in healthcare reform that would speak to that or impact?
Under the newly eligible group, we asked to find no asset requirements anymore. The newly eligible. So that is going to make, and if they're in the 133% or below, that is going to make more of that population, or all of that population, potentially eligible for long-term care. So there won't be the asset test requirement that there is now.
Right, and the follow-up to that was, how might the healthcare reform affect menu of service options available? I think what they're getting at here is balance between residential-based and home community-based care.
Well, I don't know if it directly does, but I think indirectly it will, because they were more challenged over time to keep trying to provide alternative ways to provide services less expensively, less institutional settings. So that's going to drive us towards other kinds of reimbursement mechanisms, and I think that's a constant kind of discussion. And as you expand the eligibility groups, as you look at streamlining eligibility processes, I think the other side of it is you're going to look at how you provide more services you can provide more efficiently.
Great. Moving on to Susan, you mentioned that Iowa had carriers that have left the insurance market. Can you give us an idea of just how many that is, or what proportion those carriers represent of our insurance market?
Right now, the carriers that are determined that they're going to exit the individual market are some of the smaller carriers, the ones that don't have a large book of business. The concern that we have on that is that it's twofold. Number one, you want to have a healthy market. You don't want to have one large one, which everybody thinks we already do in Iowa, and then there's everybody else. And also just market disruption for consumers. We've found over the years that people, if they are comfortable with a carrier, they really want to stay with them. And they don't necessarily want to shop around. They don't like market disruption. We found that even in the high-risk pool. We have people right now in the high-risk pool who could move to the private market, but they know what they have right now and they want to stay there. And so our concern is for those people who have been perfectly happy with these smaller carriers that they're going to leave the market. Another issue that we're concerned about is when we set the medical loss ratio targets, and what is in and what is not going to be included in that numerator and denominator. Right now, the thinking from the commissioners is it will be on a state-by-state basis. It will not be an aggregate around the country. So if you are a company that is doing business in multiple states, and let's say your medical loss ratio in one state is 65% and your medical loss ratio in another is 105%, you can't aggregate that. So carriers will have to make a decision about what states they're in and what states they're out. And so we're going to be watching this very closely. And at this point, we're just talking to some of our smaller carriers, but clearly some of our smallest will probably will be exited.
And hold on, speaking of the high-risk pool, a follow-on question was, has applications started to be processed into the new high-risk pool?
No, they have not been. What happened was we had everything ready to go. As you know, HHS must sign off on your proposal. But the states had a real concern about liability back to the states. If you get into the pool and you start to accumulate, we only have $35 million for 4 years. So what happens when you get very close to using up all those dollars? There's no backstop, there's no assessment to the industry, there's no reinsurance, there's no guarantee fund, there's nothing. And so the administrator wanted to make sure that the state would be held harmless in the event that we got down the road here before 2014 and did not have adequate funding. That is in place now. We're just getting the sign off this week that we can start getting applications. HHS put up on their website to call our office directly for to sign up. Thank you very much. That's not, please don't call me. So we are trying to get that all coordinated, so by the end of the week, the process will start working.
Okay, thanks. Terry, you made the point that implementation of the healthcare reform will be decentralized and states are going to have a considerable amount of discretion. Can you discuss how some states have taken some initiative in regarding to establishing or anticipating the structure of these exchanges?
Yeah, there's, well, of course, we have several states that already have exchanges. Massachusetts has one, but actually hasn't been talked about much, but they're started just covering individuals, and then they developed a pilot program to expand to small employers. So they're actually going to, going through the process of how would they actually expand it to small employers. There, Connecticut's had an exchange the opposite side, only for small employers through the CBIA for 15 years, and they have 5,000 companies participating in that exchange, 75,000 people covered. So there's this small employers only, there's no individuals in it. Utah passed, set up an exchange, and they, a year ago, more like 2 years ago, and they got it going. They had some hiccups with it. Their legislature made some modifications in the last year. And of course, now they're back at saying, well, okay, they're looking at everybody else. Where are we going to be in 2014? The California House and Senate have both passed a bill, and it's in conference committee or negotiation now. And what they're trying to do is pass a bill that would implement some of the insurance reforms and also sort of, I would call it stage one. They're not trying to answer all the questions, but they're basically putting in, creating the entity and the governance structure and some basic decisions. And then that exchange will be coming back with some reports on some of the more complex. And like it said here, they're waiting, for some guidance from HHS on that. Oregon and Washington, their exchange and have people working on that, and they'll be reporting that back to the legislature. And they've also asked for the creation of a business plan for how to create a public option within the exchange. So that'll be interesting. That was one of the controversies, but there's nothing to prevent the state from creating a public option if they want either inside or outside of the exchange. And a lot of other states, I think, legislators are drafting bills to have ready in 2011. Many states only meet every 2 years. So they pretty much have to pass a bill if they're going to in this winter 2011 because they won't be meeting in 2012. And some legislatures have a very short session in 2012. So they're, people are trying to get legislation drafted to implement.
Thank you. And Kristine, on one of your slides, the last slides of your presentation, you presented a statement that says, continue to build a cleaner risk pool. Can you explain a little bit more about what that means?
Sure. The cleaner risk pool is a healthier risk pool. So utilizing our wellness programs in a way that can help control people's diseases, help maybe prevent diseases that may happen, catastrophic events that are controllable. Obviously, there are catastrophic events that are going to happen that are out of our control, but to maintain a healthier risk pool, a cleaner risk pool, a healthier risk pool, is to utilize and leverage our wellness programs to help our employees learn about their health and control disease states and hopefully prevent and minimize disease states.
Thank you. And I ask you all to join me in thanking our panelists for what has been a diverse and insightful conversation.